Thank you very much. And I'm now going to introduce Dr. Mike Evans. And Doc Mike Evans, as many of you may know, is a legend in Canada and worldwide through his ideas and the many innovations that he is going to share with you today. Doc Mike Evans.
Wow, that was great, Melinda. I'm still kind of freaking out that somebody has to make anti-nerve gas, so I'm still on that one. I'm sort of a kind of different version of Melinda. She was talking about adversity and how that kind of created her own why. My story is probably a bit more about failure, and I'm not a family doctor, just sort of works around the corner, and I live around the corner, I bicycle here. And so I'm just going to talk a little bit about my perspective as a clinician, and also my second job is I run a lab, and unlike the labs that Melinda was talking about, there are no white jackets in my lab. My lab is filmmakers, patients, designers, MBAs, and we kind of get together and make content. And so our work is taking sort of best evidence, what we call critical appraisal, and we kind of combine it with design thinking, and we build things. And we probably been less successful at the positive change, but we sort of set the sort of foundation for positive change in people's lives. So, my sort of major point is I work in a big academic hospital. 1 in 1,000 problems makes it in there. I'm a family doctor, so I work in primary care. About 1/3 of problems come into primary care. So family doctor, physiotherapist, pharmacist. 2/3 of healthcare problems are actually solved at home. And so when we're thinking about improving the healthcare system, we're so focused on MRIs and fancy machines. But really, it's about creating a place in people's lives that they can solve problems at home and having that kind of conversation. So most of our work, the success has been, before we came along, most of the patient education material is telling people what they already know. So don't pour boiling hot coffee on your crotch. But it was don't smoke, don't eat starch fast food, whatever it was very kind of what people already know. And in my clinic, what we would do is just tell people data. You know, you have an 80% chance of this, or here's how prostate cancer screening works, or whatever, and we kind of smother people with data. And as you guys know, stories trump data, and relationships trump stories. And when we think of relationships in healthcare, we think of doctor or clinician to patient, or healthcare institution to patient. But really, the biggest healthcare workforce out there that's completely underutilized is what we call peer-to-peer healthcare, so the public. So friend to a friend, mother to a daughter, and that, of course, has been mobilized with social media. That you see so much of that now. And so I think in a lot of ways relationships trump stories. And we tell evidence-based stories and we embed them in the relationships of care. And sometimes that's clinician to patient, but mostly it's just friend to a friend. And I think in many ways, individuals, and Dave's a perfect example of this, are now trumping organizations because they're passionate, they stand for something. And so with our medical school online, we built a medical school online with YouTube. And here, you know, University of Toronto has, you know, it's the biggest university in Canada, maybe 70,000 students. Well, we have had over 11 million people come to and see our lectures online. We have over 200,000 new people come every month. We have 50,000 students or subscribers. And we've all started this with no funding, it's all self-funded, and this is what's sort of incredible about the world now, is that a family doctor sitting in Starbucks, which is where my offices are, can just start something, and really it's about kind of authenticity, It's about social capital, and I mean that partly around social networks, but mostly about people want to give something that they believe in, messaging-wise, and we create engaging videos that people want to give to one another. So we built this whiteboard series, so it's everything from things that Leslie would be interested in, like quality improvement, to things that you would be interested in, so it could be low back pain, stress, early childhood brains, to things my sons are interested in, which is flatulence and acne. And then we, not everything's viral, and we do quite a bit of what we call bacterial work, so we do stuff around dialysis or inflammatory bowel disease. These are free and available to everybody in the world online. We've also built a whole bunch of other media, and this is the sort of fun part of our job. So it could be podcasts. We do a series on CBC. We copied Jerry Seinfeld and did a series on having coffee. Infographics. We actually build little text messages. My wife and I are both doctors, and we have kids, and so all the parents are texting us. Yesterday, it was a friend of ours had a scaphoid fracture, their kid, and so everybody's like, scaphoid fracture, WTF. So we just sort of copied these and send them out to people. So lots of fun building all these things. And we've had all these great success stories. So a coding guy in San Fran watched maybe our most famous video called 23.5 Hours, started walking every day, lost 90 pounds. So he built an app that when you've walked half an hour, it goes, great job. We were on Orange is the New Black, which is, have people seen that? Yeah, it's great. I had a little bit of a hard time explaining the plot line to the nuns at St. Mike's, but I did tell them there was a nun in it, so that was good. Anyways, the lead protagonist used our video to explain why they should have a track in prison. And then this is sort of interesting just to think about it. So we allow people from different countries to pretend they're me, and they translate our videos. So it can be a woman or a man, so we had a guy in Riyadh, a public health doctor, pretend they were me, and they just translated 23.5 hours into Arabic. We put online, and it had 800,000 views in a week. So it costs us quite a bit to build the videos, but it costs us about $200 to change the sound file. And Arab nations have very high rates of diabetes, very high rates of inactivity. And so for $200, we had 800,000 people in a week watch a 9-minute video to hopefully get some cognitive dissonance around exercise. Now, Ultimate Pizza Sandwich is still in first place. So it was the 5th most watched thing in all of YouTube that week. So just so interesting how the world's changed and how we can message to people. Clinic, to me, is just sort of hanging on by a thread. So, I had an 87-year-old come to me about 2 years ago, and she said, she just come to me and she said, she was on sort of 10 medications, and she said, Mike, my husband is in year 3 of Alzheimer's, and I just can't leave the house. Can I email you? And you can't tell an 87-year-old woman, no, you can email me. So we started up an email clinic, and which I don't get paid for, which is actually great because it leads to all sorts of innovation. You can be a sort of leader. You may be a poor leader, but you can be a leader in this. And and it's so interesting because now I have all these people with chronic diseases that I would have seen 9 times last year. Now I see them 4 times when we have 10 emails. And their user experience and my user experience is much better. You look at, I do quite a bit of work with Kaiser Permanente in California. Their docs are paid on salary. And so when you go visit them, do you want to visit Mike in the clinic? Do you want to phone them, or do you want to email them? And now 40% of their interactions are done outside the clinic. We're looking at building, just broadcasting things to our health communities and linking them with coaching and so on and so forth. Sleeping pills. We're prescribing sleeping pills all the time. Karen Glass's review showed, at least in the over 60 crowd, it probably added about 20 minutes and has all sorts of negative consequences. Now there's 10 years of data, NIMH data, looking at web-based CBT. So now I prescribe Sleepio or one of the other online CBT programs for insomnia. More effective, more longer lasting. So our clinics are just so kind of blockbuster video and ready to be changed. So this is interesting. This is an area that I haven't tapped, and I'm sure many of the people of you are tapping, but I just feel I'm doing this whiteboard with Susanna Fox about community. And so her point is, you know, for these rare diseases like Mobius syndrome, there's an incredible power to them building community, and they're way ahead of other disease groups, these big disease groups, so low back pain or diabetes. And so this is Emily Nicholas, who works with me, who's a patient engagement superstar, had her hip replacement, she was young, and this is her Facebook as she's, you know, as they're sort of discussing problems, and this guy's waiting for Mr. BM, as they say. And what's so interesting is this is like 136 people talking about looking forward to a bowel movement. Of course, doctors never talk about that. As we all know, it's the #1 indicator of health in my patients over 70. So, so this is the disconnect we have with our patients, and allowing them to have communities and discuss these things is so powerful. This is another one. This is a shot. This is actually one of my kids, my middle son. And the two things that you need to notice about this one, it's interesting. So this is his date, Eloise, and they went to a semi-formal, and they went to the same one last year together. And in between, Eloise was diagnosed with Hodgkin's, so she's wearing a wig there. And as soon as she went online with her disease, she had about 500 or 600 new followers on Facebook. So she put up her going to the semi-formal, which of course my son never even told me about. And she had 469 likes in 6 hours. Now, I don't know about you guys, maybe you guys are way better than me, but when I get like 12 likes, I'm like, so you see what I'm saying? Just that community for her, and I don't know whether it's the best or worst, I'm sure there's nuances, but just incredible how the world's changing. We're sort of developing something for 15-year-olds, 16-year-olds around Hodgkin's. The tricky thing with kids is as you build something for a 15-year-old and you make it more nuanced, it becomes less useful for an 18-year-old or a 10-year-old. So it's interesting. This is a big thing that drives our work. Is we are very focused on things that are good for a lot of things. So this is an Agneta Akeson's trial on Swedish men. She did the exact same thing on Swedish women about 8 or 9 years earlier, same trial. Anyway, she followed them for heart attacks, 20,000 men, and then she followed 5 lifestyle risk factors. So not drinking too much booze, not smoking, trying to keep your waist circumference down, eating well, and moving. So when they did those 5 things, how much do you think they reduced their heart attack rate by? 80%. So, you know, I don't know, if we look at stents versus exercise for people who have had heart attacks, exercise cream stents. You know, we don't talk about it. I've got a medical student working with me now who went through her whole medical school and wasn't taught how to prescribe exercise once. Do you see my point here? We're missing the things that work best as we focus in on these micro things. And how many people do you think actually did all 5? And these are Swedish men. 1%. Now the woman, it was 5%. So as my wife says, they were 5 times better. So I think we have to kind of be mindful of that as we innovate, is to see that bigger picture. We're just building a lot of content stuff, and we're partnering with a lot of other groups to embed them in larger, what I would call nudge interventions. So I think a lot of you know about nudge, and Lucien would know about this toilet. So this is the urinal in Schiphol Airport, and So just to explain nudge, every grocery store you go into is nudged out to get you to buy whatever. If you put salad in front of burgers in the buffet, your salad rate goes up 25%. In Schiphol Airport, as is universally occurring, they have a problem with spillage in the men's urinal. And so some genius went in and engraved a fly into the deepest recess of the urinal. And so the men of all different cultures and ages and whatever just come up and try and kill the fly. Like the video game for men. And so they don't even know they're doing it, but they reduce the spillage rate by 80%. So this is the future of healthcare, whether it's a clinician or a patient. So Leslie will tell you, or at least I think she'll tell you, this is certainly my view, is we have to make it easier to do the right thing, or clinicians don't really change their behavior so much. And I think it's true for patients as well. We're building big things around eating, and it's very much around choice architecture and nudge. And on that point, I spent a fair amount of time out at Apple. I tried to scan the Apple Watch last month. But
I'm just doing the sound.
They're very secretive, and they kind of put me in a room and asked me all these questions. It sounds bad. It's not bad. Beautiful room. And but just to say, their vision of the future is that if I'm seeing Lucien in my clinic and he has high blood pressure, and he comes in and he's had a venti latte, and he's been sitting in my waiting room for 45 minutes, and he's sort of pissed. And then his blood pressure is, and my waiting room has a security guard in it, so there's lots going on there. And so his blood pressure is high. He may have some white coat hypertension. So now the watch will measure that. It'll actually data visualize it back to him. He'll be able to compare to other people his age and gender. He can share his results with his book/wine club. We have book clubs in Holland. So it's, and then I'll be able to drop in one of my whiteboards and say, hey, when you have high blood pressure, it's pushing against a high pressure system, and your heart becomes an Arnold Schwarzenegger, and we want a long distance runner. The DASH data will drop in there. Half of people on antihypertensives stop their medication after a year because it's a silent illness. They think they're fine. So they just stop it. And we'll be able to monitor that. Siri's going to come on and in a Jewish mother's voice or Ryan Gosling's voice or whatever works for you, it'll say, you've been sitting, Lucien, for 4 hours. Get up and move around. So the point being that I see Lucien 3 or 4 times a year for his blood pressure. The phone sees him every day, and will nudge these little behaviors. So it's so interesting. So this is my last slide, just where we're going. So we have some fun projects. We're bundling 23 and a half hours into a large trial with a whole bunch of organizations, combining everybody's getting monitors so they can have Moves or a Fitbit or an Apple Watch or whatever. And we're actually dropping in all these behavioral bombs, a lot of nudges, and we're building in some rewards and just sort of experimenting with people, getting people moving at work, putting up cardboard standing desks and so on and so forth. Make Your Day Harder is a movement we're developing about, not about going to the club or whatever, but just getting off a stop early, taking the stairs. I put the video out the same day I did a radio show on erectile dysfunction, so we had lots of hits that week. But so it's so interesting as we sort of can nudge people towards more activity. Beer League Doctor is basically a doctor in a locker room answering questions, and it's going to be a lot of fun.